Hi, guys. Welcome back for our daily practice questions. It is day 57, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, which of the following is the key difference between the Somogyi effect and the Don phenomenon in diabetic patients? Is it A, the Somogyi effect involves a rebound hyperglycemia due to excessive insulin administration at night, whereas the dawn phenomenon is caused by a natural increase in hormones like cortisol and growth hormone? B, the Somogyi effect occurs due to an increase in cortisol levels, while the dawn phenomenon is caused by insulin resistance during the night. C, the Somogyi effect is related to a decrease in cortisol during the night, while the dawn phenomenon involves a rebound effect from inadequate insulin. Or D, the Somogyi effect is associated with insufficient. The Somogyi effect is associated with insufficient glucose, and the dawn phenomenon results from diabetic ketoacidosis. Take a moment to what you got, y'all. Which one do you think? All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. In this scenario, the stem is the question is the stem, right? So, which of the following is the key difference between Somogyi effect and the Dawn phenomenon in your diabetic patients? Y'all, an A is your best answer. Remembering Somogyi effect involves that rebound hyperglycemia that happens in the morning after having that excessive insulin administration at night, leading to hypoglycemia at night, right? Whereas dawn phenomenon, you just have natural early morning hyperglycemia. All right, question number two. A patient with type 2 diabetes is experiencing high blood glucose levels upon waking in the morning, despite having no issues with their evening insulin regimen. Which test would be most helpful in diagnosing if this patient is experiencing the Somogyi effect versus the dawn phenomenon? Is it A, fasting blood glucose level in the early morning before breakfast? B, a 2-hour postprandial blood glucose test? C, a 3 a.m. blood glucose test and evening blood glucose assessment? Or D, a random blood glucose test in the evening? Take a moment and tell me what you got, you guys. All right, so stem of the question states which test would be most helpful in diagnosing if the patient is experiencing the Somogyi effect versus the Don phenomenon. All right, so we have to do a couple of things to determine and be able to differentiate one versus the other, right? So remembering that Somogyi effect has rebound early morning hyperglycemia after having that hypoglycemia at night. So a couple of things. We want to do C. We want to get that 3 a.m. blood glucose test, right? To determine that early morning hyperglycemia, and also get you an evening blood glucose test too to see if there's any noted hypoglycemia. All right, and lastly, question number three. Which of the following symptoms would suggest the Somogyi effect rather than the dawn phenomenon in a diabetic patient? Is it A, morning hyperglycemia with a history of nighttime hypoglycemia? B, elevated blood glucose levels in the early morning due to the natural release of growth hormone? C, a gradual increase in blood glucose during the night? Or D, high blood glucose in the morning due to increased insulin resistance after waking? Take a moment and tell me what you got. All right, same scenario here. The stem is the question. The question is the stem, right? So, which of the following symptoms would suggest this emoji effect rather than the dawn phenomenon in a diabetic patient? And A is your best answer here. Remembering morning hyperglycemia with a history of nighttime hypoglycemia. is what shows you the Somogyi effect, right? Whereas dawn is just simply the natural early morning hyperglycemia. Now, y'all know how I do. I like to do knowledge style questions to make sure you're getting it. So you saw a couple of these that were similar, but I'm just trying to make sure that you understand the difference versus emoji versus the dawn phenomenon. Now, tomorrow, we'll dig a little bit deeper and try to apply this knowledge and making sure that you have it and are able to retain it, okay? All right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, I always say either call, text, or email because I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.